Croakeys. I just thought I'd contribute a few thoughts about the budget last night. I was in the lockup and I talked to a number of stakeholders there about their immediate reactions. The first thing I'd like to say is clearly it was a budget that was very much focused on health and medical services, and I think Michael Moore from the Public Health Association summed it up really well when he said it was really about medicine in the narrowest sense. It was a medicine budget and not a health budget. And I think Chris Cliff from the Coalition of Nursing and Midwifery Organisations also said the similar thing when he said, if it's not about doctors and drugs, then you didn't have a chance in this budget. So clearly the largest initiatives, as we've seen, were the initiatives to do with PBS medicines, the unfreezing of the rebate, and the zombie measures from the 2014 budget, and also the Tasmanian Hospital, Mercy Hospital initiative. And altogether they are around about $4 billion of the spend. So I think while there are a lot of other smaller initiatives, and certainly some of them are quite positive, so breast and cardiac device registries, stoma appliances, diabetes insulin pumps, and no one's going to argue with any of these. We're talking about a very small amount of money compared with the spend that's on the PBS and Medicare. Rheumatic fever was another one that was mentioned as a positive by some of the stakeholders last night. But again, the amount that we're spending on those in this budget is quite small compared with the amount that's going into Medicare and the PBS drugs. And just to put a little bit in perspective, the Department Secretary Martin Bowles in his speech last night did make a big point of talking up the overall spend. But when I looked at the figures, the increase is around 2.8% of the overall health budget. And if you look at the annual average GDP increase, that's around 2.7%. So while the budget does represent an increase overall in the health budget, it's not really an increase that will increase the total amount we're spending on health as a community, because it is pretty much tracking with our GDP increase. So again, the issues this raises, it's not a panic situation. We are not outspending ourselves. There is no crisis. We could indeed spend more money. And I think it's always good to remember that. The other things I would like to raise is this I thought was kind of hilarious. The funding for the Healthy Heart Initiative. Now, obviously a very important issue and welcome in a lot of ways, but the thing that I thought was worth remarking on was that the National Heart Foundation very cleverly have named their initiative the Prime Minister's Walk for Life Challenge, and that was one of the few preventive health initiatives that got funded. Now, again, very worthy initiative, and Rowan Greenland from the National Heart Foundation made the point that obesity is really a key risk factor for heart disease and a number of other conditions, and walking is a very important exercise. But again, this is not the only initiative that could potentially deal with obesity or promote walking. And I did think it was amusing that naming it the Prime Minister's Challenge obviously appealed to the government, and it attracted $15 million or so in funding. The other one, I think, need to mention this guaranteeing Medicare Guarantee Fund. Again, I think this is just all about the government signalling that it is now Medicare's best friend, and it has repaired its relationships with the medical profession. It is obviously trying to undo the damage done by the Medicare, quote unquote, campaign from Labor in the last election. And this is one of the ways it's trying to do this. I mean, I think in itself, it's obviously a bit of a gimmick. I mean, the government is the government. It can spend the money wherever it likes. Putting it in a jam jar labelled Medicare is not going to really do anything, but I think it does. The government's aim is to send a message to the community that we are, the defenders of Medicare. Please don't change your vote to Labor for that reason, because, you know, we're strongly aligned with Medicare. The reality, of course, may be something quite different. The other thing I'd like to mention, there was a lot of talk last night at the lockup, and from both the Minister and the Departmental Secretary, about these what they're calling a landmark compact. I don't know if you can see that. This is from the Department of Health's website. If you go to their homepage and to the budget initiative page, then you'll be able to see these compacts. So they're really talking these up. Both the Secretary and the Minister last night made a big deal of how they were working closely with the pharmaceutical sector. Indeed, it was almost like they, you know, together were now the sort of collective health ministers together developing the budget. They've kept calling them those landmark compacts. I kept thinking about face powder when they said that, and you can actually see they have put copies of these compacts, so-called, on their website, and you can go and open them. So I went and had a look at look through them to see exactly what they are. They are something that we haven't really heard this language before. Clearly it's part of the government's overall attempt to look like they're forging a new direction in health and breaking away with the previous government's direction, which did get the medical and pharmaceutical sectors offside. And so they have been working closely with this very small group of stakeholders on some of these initiatives. And I think, you know, while obviously the government consulting with stakeholders is a good thing, I do have a few questions that I would like to be asking the government and these stakeholders about this process and what actually they are. I did have a look. For example, this is the AMA's compact. It is 2 pages. That is all. It includes things like commitment to affordable health care, support for investment in evidence-based mental health services, recognition that both the public and private health systems support universal health care. So nothing really that's going to surprise anyone. In fact, you know, you could say that for close to $1 billion in the unfreezing of the rebate, if this is all the AMA has to do, that's a pretty good effort. I wouldn't mind getting, you know, $1 billion for putting together 2 A4 pages of motherhood statements either. So I think my concerns about that is what exactly the status of these, you know, compacts are, who has been involved. There was no mention last night of discussions with other broader groups, consumers, nurses, you know, the rural health sector, Indigenous people, all groups that you think would have a very big stake in health reform. There was no official process or no transparency around how these agreements had been brokered and what indeed will happen if they do not deliver. A lot of the wording in them does seem to be very, very woolly. So my concern is that this is, again, you know, a process where the government is trying to deliver some short-term political aim, so shore up its credentials around Medicare in the lead up to the next election, and very little about any long-term reform agenda. And I think, as the Consumers Health Forum pointed out, there is really very little about reform in this budget. It's really just about repairing some maybe, you know, shorter-term cracks from previous budgets, such as in Medicare, but little that points a direction forward. And I think many of the people at the lockup last night were disappointed, not so much in the overall spend or the money that's being put into unfreezing the rebate, but just the fact that it's not within the context of some broader reform agenda. It's just more into Medicare, fee-for-service, old-style medicine. And in fact, when the Minister and the Secretary talked about the government's long-term plan for health, which they are seeing this budget as part of, They certainly presented their priorities as looking after, Medicare and the doctors, the pharmaceutical sector and private health insurance before they moved on to other areas. In fact, said that their last priorities would be prevention, public health, Indigenous health and primary health care. And I know for a lot of us that those are the areas that really should be looked after first. They are the most important. If you invest in primary health care, prevention, Indigenous health, as we know, then you will reduce the need for pharmaceuticals for hospital services and increase the efficiency overall of the health spend. So in many ways, it does feel like the government has really got this sort of backwards and is focusing on the one of the less important areas before going into looking at some of the structural issues and the reform issues that we really need to get right before we start investing in the health service delivery. But overall, it's definitely not the worst budget we've seen. There are some good things in there. There are a few question marks around process and what that means going forward, and some details to be worked out, and certainly a politically driven budget, but one that leaves a lot of questions about reform and about the future of our health system still up in the air. Thank you. I really look forward to hearing your comments. Please send us comments to Croakey, what you liked about it, what you didn't like. Really look forward to furthering this discussion with you.